Hello, have a good day. Today, I am Professor Yamini Bhushan Tripathi again with you, and I am going to talk today food and hunger in palliative care. You know that most of the time, the patient who is chronically ill, they lose their appetite and they lose that interest in eating, and that is a very peculiar stage because in this condition, their nutrition gets compromised and which is not good. So cells need full nutrition, and nutrition can only come when a man eats, and that hunger and appetite is lost. I think that for improving the quality of life, it is very important to explore the hunger and taste of that person to whom we are giving palliative care. So the main thing which I am going to talk, the digestive power and hunger in patients undergoing palliative care. Usually the patients who are old age brings numerous physiological, psychological and metabolic changes affecting the nutritional need and a low digestive power. Thus, one need to maintain the digestive system and to induce hunger. This would help adequate nourishment of the body and maintain energy and improve the quality of life. So, poor digestion, why it is happening? The age related, the primary causes are the age. Then chronic illness like neurological conditions, diabetes, chronic kidney disease. Third is the medication side effect. Because these people are taking a lot of medicines, the medicines have their own side effect. Some medicines produce gastritis, some produce constipation, some produce loose motion. All these things restrict a person, make him afraid of eating. That is a kind of disinterest created in the patients. That has to be worked out. And then dietary factors. What is the likeness of that patient? What we are giving? Because he is living in a family. And family, something is being cooked for everybody. And that person may like and may not like. That has to be addressed by the person. And psychological factors. Well, suppose you are under depression, you are not willing to eat, you are not willing to live, and that is the main problem. That has to be taken care. If you look at the biochemical part of loss of hunger, then decline in the digestive enzymes and secretions. In the digestive enzymes are secreted from the liver, they are secreted from the pancreas, and they are secreted from the gastrointestinal tract. So all the three organs are responsible for producing enzymes and hormones which are responsible for digestion. If these are not working properly, the digestion won't be there. So whatever you are eating, it is not being digested, absorbed and assimilated. So where will nutrition come? It will not come. Then change in the gut microbiota. The gut microbiome is very important. There are millions of bacteria, healthy bacteria, and they should continue. For that, there are the medicines like the prebiotic and probiotic. If you are losing with the age, the microbiome is changing. Because of your mental state, the microbiome is changing. Because the environmental environmental changes, microbiome is changing. So you have to take care how to nourish them. Third is the gastrointestinal hormonal changes. I told you the gut and brain have a connection. So how, if you are under depression and anxiety or stress, your hormones will change. The digestive system will change. The vagus nerve behave in a different way. So parasympathetic nervous system will not be proper. So under stress, it will not be proper, and the sympathetic nervous system will be more active. That will also create a problem. And then malabsorption and nutrient deficiency. Malabsorption is a term, is a medical term, where you are eating good quality of food. It is being digested also, but it is not being absorbed. In the intestine, there are the villi, like a finger. And these layers in the villi are responsible for absorbing the food. If they are damaged, they are inflamed, they are not functioning, nutrition will not go into the body. It will go out in the stool. So that is the malabsorption. And oxidative stress and inflammation. In the aging process, the people are having systemic inflammation. The body is having the C-reactive protein and HSCRP. They are the two parameters like IL-6, third cytokine. They are high. The systemic inflammation is high and oxidative stress is there, that is also a bad part. You don't want it. And the energy metabolism axis. Then hunger and loss of appetite in elderly patients with NCD are common and complex. Loss of appetite may be due to disease progression. If you suppose you are a cancer patient, the disease is progressing, definitely it will affect all your physiological process. Then medications, I have told you. Then psychological factors and oral health issues. Suppose your teeth is not there, you are always not able to chew. So you don't want to eat because it pains you. And then gastrointestinal issue, I have told you, metabolic changes, inflammation I have told you. Then management strategies, nutritional modifications like hydration and probiotics, I told you earlier. Medication adjustment, if some medicine is having a side effect, we have to reduce the dose. And if required, we have to give the digestive enzymes as a supplement. Like the pancreatin is a enzyme concentrate which is given in capsules, which helps them in digestion. And physical activity and positioning, this is also very important. Physical activity, if you are not physically active, most of the time, the old people in the palliative condition, and they are the bedridden, or they are not able to do their job by themselves, they are dependent with the family members. That creates a problem. The physical activity is declining day by day, and we as a palliative caregiver, we have to take that part also. If these things are changing, automatic appetite will change, and man will start getting interest in eating, and that will increase the appetite. And then the psychological and emotional support is required. An alternative therapy like abdominal massage for the constipation relief, acupuncture, acupressure, Ayurvedic-based digestive herbs like ginger, fennel, ajwain, these things are also supportive. This is a diagrammatic presentation, hunger management I have shown you, small healthy meals, social eating, some people should accompany you, you should not be in the monotonous, and gut-brain hygiene I told you, emotional with support, and rest. All these things are very important to maintain your hunger. And mood and reward disruption in elderly with NCDs. Dopamine and serotonin are the hormones which are called happy hormones. If these hormones are under secreted, you are under depression, you are not happy, and that is also a cause of loss of appetite. So if you can see, low dopamine level, mood swing, poor appetite due to low motivation, and sleep disturbance. This is also important. I have told you in the earlier slide that there are three basic pillars of good health: diet, sleep, and lifestyle. So sleep is very important. So these are the hormones which I told you earlier. The ghrelin is a hormone, leptin, TNF-alpha, IL-6, serotonin, dopamine, insulin, and cortisol. They are affecting, you see, ghrelin is stimulating the hunger. Leptin is inhibiting the hunger. TNF-alpha is inflammatory cytokine, as I told you. And serotonin, dopamine is a mood and reward. And insulin regulates the blood glucose. And cortisol is a stress response. You see, all these hormones are having different kind of physiological actions. And they all have to be managed. They are all in coordination with each other. So your behavior, lifestyle, and sleep, all the three things are important for this. Okay? And in the patient with the non-communicable disease, NCD means non-communicable disease. This way, ghrelin is suppressed, leptin is increased, TNF-alpha is increased, catabolism, and serotonin is already in this case, these things are conditions. So we have to reverse it. These things have to be reversed by your palliative care. So this is the odd detail. You can read it. I'm giving you the PDF of this. It is more detailed biochemical disruption and the preventive measures. These are the preventive measures like small and frequent meals, warm soups to trigger the appetite, avoid overfeeding, maintain regular meal time. The timing is also very important. So what time you are eating, what time you are sleeping, that has to be maintained. Anti-inflammatory food like turmeric, omega-3 fatty acids, light physical activity, they are very important. And emotional care, music, social eating with family is important. Don't live in isolation. You have to be with your family members. Reduce stress with rest and support. Light activity is important. Use zinc-rich foods like nuts, seeds, and legumes. And a light exposure, calm environment, high tryptophan food is important, like curd and banana. And monitor sugar level. If you are a diabetic person, monitor sugar level, adjust food, because sugar also controls your food appetite. This is a slide which I have summarized all these hormones you see, ghrelin, leptin, everything is given there. This is a summary of what I have told you earlier. So the three tips I told you, diet, sleep and lifestyle, they have to be followed in the patient. And if it is not proper, as a palliative caregiver, you have to consider, listen sympathetically to the patient, and then try to change it as per his desire. Psychologically, he should be satisfied in all the three concepts. Otherwise, he is not going to be happy, he is not going to eat anything. So nutrition and quality of life, the proper nutrition involves two steps: balanced diet for eating, proper digestion for ingested food, and selective absorption of digested nutrients, and transport of the absorbed food to different organs, tissues and cells in the body, and then ultimately proper metabolism in that particular tissue which is weak and need to be strengthened. Suppose the patient of the stroke is there, means a paralytic person, his nervous neurons are weak, they are not responding. So something has to be done to strengthen the neurons, and you know the nerve cells do not divide. So they have become, some living cells are there and they have to be strengthened. Which are dead cells, they will remain dead. But weaker cells still there, they can be strengthened by doing all these things. The whole process is the basis of quality of life. So digestive power, in Ayurveda, you know, this slide, Jatragni, there are 13 type of Agnis. This is the Charak Sutra, 15/3-4. The 13 Agnis, the Jatragni is the digestive power. Bhutagni means the intermediary metabolism, and 7 dhatus. There are 7 dhatus in the body, there are 7 Agnis. There are total 13 Agnis, but this is the master Agni. Like in the endocrine gland, you know, pituitary is the master endocrine gland. Similarly, in the Agnis, Jatragni is the master Agni. If this is good, let's come back to the slide. Digestive power. In Ayurveda, there are 13 types. I have told you, Jatragni is there. So this slide shows. And how it is disturbed? There are 3 factors: improper use of sense organs, chronobiological changes, and psychological insecurity, pragya parad, kal parinam, and asatma indriya yoga. So these 3 factors affect and produce disease. And disease, the main cause is the improper Jatragni. This is a link. So this slide also shows if your Agni is good, so you are having long life and healthy life. If your Agni is low, you are having diseased person. And this Agni, intestine, liver and pancreas is the place of Jatragni. So you have to take care of this part, okay? And this is governed by, I told you, mental state of mind, anxiety, depression, and environment where you live. So this is one slide just to introduce you. I'm not going to talk in this lecture, but there are the 5 koshas, 7 chakras, you know. There's a Mooladhar, Swadhisthana, Manipur, Anahat Chakra, Vishuddha Chakra, Agya Chakra, and Sahasra Chakra. These are the chakras you need. This is the Mooladhar, this is the Swadhisthana, this is the Manipur, your Nabhi, you know, navel portion. This is the Nabhi, Manipur. Anant is the heart path, Anahat Chakra. This is your neck, this is your Agya Chakra, your eye, between the 2 eyes. And this is this one. So these 7 chakras control your health, and there are 5 koshas. This is the Annamaya Kosh, physical body, Pranamaya Kosh, vital energy body, Manomaya Kosh, mind body, and the Vigyanmaya Kosh, wisdom and body, and Anandamaya Kosh, bliss. So 5 layers, you see, these are the 5 layers, and they are the 7 chakras. Both are connected to each other. That is why the mind-body relation is becoming so popular nowadays. And in palliative care, we can focus this kind of thing also. Many people can understand. And next important point is the circadian rhythm. As I told you, there are the 4 hours cycle in the day and 4 hours in the night. You see, 2 p.m. to 6 a.m. That is the Vat time. 6 a.m. to 10 a.m. is the Kaph time. 10 a.m. to 2 p.m. is the Pitta time. This is the day. Similarly, go in the night, this is the night. This is morning, and this 2 a.m. in the night to 6 a.m. So this is the cycle goes on, and this cycle changes. We have to live accordingly. The next point which I want to say in the hunger is the incompatibility. The food should be compatible to the person. So there are 18 conditions which make the food incompatible. Viruddhar, in Hindi we call Viruddha Ahar. The food which is not compatible to you, you should not eat. And if you will eat, you will get diseased. So there's conditions are there, when to eat, what to eat, what combination you should eat, how much you should eat, what is the sequence of eating different foods. Everything is given in Ayurveda. Incompatibility, this you can go through this slide. And now examples of, I have given some example like the fish and milk, they should not be eaten together. Heated honey is avoided. Honey and cow ghee in equal amount is avoided. Hot water after taking honey is avoided. These are the incompatible list of the foods. Depending on this 18 principles which make the food not good for you. And then next comes the role of gut microbiome, as I have told in the beginning. So gut microbiomes, millions of bacteria are there. We have to take care how to maintain their health. And next it comes the practical step to support the gut microbiome. This is very important. This a palliative caregiver should know. So mechanism. So probiotic, live beneficial bacteria like yogurt, fermented food we are eating, that is very important. Restores the microbial diversity and reduce the gut inflammation. Prebiotic means like the food which helps the bacteria to grow. They are not bacteria by themselves, but they are the food for the bacteria. Probiotic is bacteria themselves. Prebiotic means the food for bacteria. Feed good bacteria, enhance the short chain fatty acid SCFA production in the intestine. Fermented food, curd, buttermilk, kanji, pickle, idli, dosa, they are the natural probiotics for better digestion and taste. And high fiber diet, fruits, millets, oats, they help bowel movement and feel. If you are having constipation, the fiber should increase in your food. Okay, Ayurvedic herbs like triphala, haritki, kutaj, they are important to gentle bowel regulation and microbiome friendly effect. And avoid excessive antibiotic. Antibiotics are the enemy of the microbiome. So if you are taking antibiotic, you make sure that you take the prebiotic and probiotic. Otherwise, your bacterial flora will get disturbed. And hydration is very important. Water is very important. If you will follow these three things I told you, circadian rhythm, don't eat incompatible diet, maintain the timing, and then do physical activity, all these things, then you will be healthy. If you are not doing because of the NCD, chronic disease, you have to revive. As a palliative caregiver, it is my duty to revive them in the patient. If you don't do, then there is a generation of undigested food. Metabolites are there, which are not of no use in your cell. They are called the undigested metabolite or non-functional metabolites. That is, in Ayurveda, they have given the word am. Am dosh is created. Am dosh means it is a Ayurvedic term, and a biochemical term. I can say suppose the mitochondria is the powerhouse, and for some time it has a lifespan. Then it dies. Once it is dead, a new mitochondria gets place in that. So why the cycle of cell division going on in a tissue, within a cell, the cycle of mitochondria also going on. Mitogenesis, mitochondria is produced, dies, produced, dies. But ATP, there is a powerhouse, the ATP is produced. But the dead mitochondria has to be removed from the cell. If you are not removing, it gets accumulated. And that is the burden. If you are in your room, if some garbage is there, your room doesn't look nice. You don't function properly. Similarly, if the unmetabolized products are accumulated in a cell, the physiology is compromised. That's why we are saying you have to remove. So, am dosha, and in modern medicine, I have told you, consider the causative factor to induce systemic inflammation. As I told you earlier, in the old age also, inflammation is there. In chronic diseases, all the chronic diseases have the body cellular inflammation, IL-6, TNF-alpha, these things are overactive. So to reduce the hunger and compromise the digestive power, this inflammation and am dosha reduces the hunger. So if you want to restore the hunger and restore the digestive power, you should remove the am. How you will remove it? The one thing is to induce the hunger. Kal bhojanam strategy is important. Kal bhojanam means time of eating, method of eating. If you fail in the second the term, Kal bhojanam means intermittent fasting. In the modern terminology, don't eat very frequently. Give a gap so that whatever you have eaten, it should be digested proper. Then again you eat. But if you are eating continuously, you are not giving time for the digestion of the food, then you will create am. So Kala Bhojanam means time-bound eating is very important. And if you do not get rid of am by doing this fasting, fasting is the best way, I should say. That's why in the Hindu religion and all the religions, the fasting has been given utmost importance. In the Roja, you say 1 month fasting is there. In Hindu religion, Ekadashi Brat, and there are many Brat fasting are there. They have clubbed the science of health with the religion so that you can follow. But if you fail, then Panchakarma therapy. What is Panchakarma? There are 5 methods: Vaman, Virechan, Basti, Nas, Rakta Moksha. So, but 4 are there: Virechan, Basti, Nas, or Rakta Moksha. These are applicable to the old people. Woman is not recommended because woman is a very active process, and the old person is already diseased. We don't recommend woman, but Virechan, Basti, Nas or Rakta Mokshan is recommended for this kind of patient. You see, to support the medicine, improve the appetite, the allopathy drugs, there are some medicines are there. In Ayurveda, Chitrakadi Bhati, Hing Vastak Chun, all these things, other ginger, Draksharist, they are the medicine in Ayurveda and they are the medicines in allopathy. They are given to prevent the anorexia. Anorexia is a term called loss of appetite or loss of hunger. You develop this anorexia, especially in the cancer patients, they develop anorexia. So how to prevent it? Either allopathy, the medicine again, but the people are they're already taking many medicines. They don't want to take more medicine. So I think this kind of food supplements like the adrak, ginger, garlic, these things are there which improve your health. Take home message: restore dignity and comfort by enhancing the digestive power and managing hunger, a path to wellness, not just survival. Appetite loss is multidimensional, physiological, biochemical and psychological. All the 3 things have to be addressed. Decline in digestive enzymes, gut dysbiosis, microbiome, hormonal imbalance, they are responsible for impaired hunger. Hunger will be lost. So low Jatragni, as I told you, Jatragni, high am accumulation in your cell are the key Ayurvedic concepts for compromising hunger and appetite. Focus on not just what the patient eats, but how it is digested, absorbed, metabolized and assimilated in the body to improve the quality of life. That has to be taken. The holistic strategy for management is diet timing, compatible food combinations, supportive herbs like triphala and ginger, and panchkarma detoxification, langan detoxification, yoga and emotional care. These things are the take-home message for any palliative care giver. If you want to improve the quality of your patient, you have to maintain his interest in eating. When interest will be created, when food will be digested, it will be palatable to him, it will be liked by him. So psychologically, if he is comfortable, then he will eat. So try to create that information. Our goal is wellness is not the absence of disease, but harmony of body, mind, digestion and spirit. Thank you very much.